Hi again. This video is about trigger points, an extremely important but often unrecognized source of pain. President Kennedy suffered crippling back pain from a war injury, and his physician, Dr. Janet Travell, not only treated him but wrote a 2-volume manual for treatment called Myofascial Pain and Dysfunction, the Trigger Point Manual. So I'd like to begin with a short statement from that work. So she wrote here, muscle is an orphan organ. No medical specialty claims it. As a consequence, no medical specialty is concerned with promoting funded research into muscular causes of pain. And medical students and physical therapists rarely receive adequate primary training in how to recognize and treat myofascial trigger points. So, this work of Dr. Travell is often assigned to medical students as extra reading, but not many doctors have read it. In it, though, she mapped out the trigger point patterns throughout the body and showed why this kind of pain is so often misdiagnosed. So, trigger points are knots, intense muscle fibers that cause intense pain, sometimes pain that's felt far from the trigger itself. So for example, muscles in the neck and the shoulder can often cause certain types of headaches, arm, wrist, hand pain, for example. So trigger points are often mistaken for pain associated with tendinitis, bursitis, or ligament injuries. And if so, the therapy tends to be ineffective. Trigger points are often the primary cause of pain in the neck or jaw, the back or shoulder, hands, hip, knee, ankle. They can cause sciatica, carpal tunnel syndrome, or rotator cuff problems. And if they're not the primary cause, trigger points are usually at least a significant factor. So medical research has shown that as much as 75% of chronic pain complaints actually originate in these knots, and they're a contributing factor to virtually every chronic pain problem. Conventional therapies often focus on bones, the joints, the bursa, or inflammation, for example. So they end up using anti-inflammatories, painkillers, steroid shots, strengthening exercises, but these are not helpful when trigger points are the source of the problem. Also, trigger points cause the muscle to shorten, which affects the bones that they're attached to. Bones move in the direction that the muscles pull them, but when they're tight, that constant pulling can cause tendinitis and bursitis, and even eventually bone deformities. I always recommend that anyone suffering from chronic pain problems begin with the least intensive treatment first. MyoLabTherapy focuses on the soft tissues such as the muscles, fascia, tendons, and their trigger points. It can bring rapid relief without side effects. And again, thanks again for your interest.